Have you ever suddenly felt intense, unbearable pain in your side or lower back, seemingly out of nowhere? Imagine you're attending your child's soccer game, cheering them on, when suddenly you're struck by this excruciating sensation, unsure what's happening or why. Kidney stones are far more common than you might realize, affecting 1 in 10 adults at some point in their lives. More alarming is the fact that if you've experienced one kidney stone, your chances of developing another within 5 years jump dramatically to nearly 50%. Let me introduce you to Mike, a friendly, energetic father in his 40s, whose ordinary weekend took an unexpected turn, highlighting just how urgent and widespread this health issue can be. In today's video, I'm going to guide you through Mike's personal journey with kidney stones. You'll gain valuable insights, practical treatment options, and effective preventive measures that you can immediately apply to your own life or share with someone you care about. Stay tuned. Mike's story could very well help you avoid unnecessary suffering and improve your quality of life. Mike had always considered himself a fairly healthy individual. He ate reasonably well, stayed active, and aside from occasional backaches, never faced serious health problems. But on that fateful Saturday, as he watched his son chase after a soccer ball, his life took an unexpected turn. The sudden, sharp pain that struck Mike's lower back was unlike anything he had experienced. Initially, he thought he might have just strained a muscle, but the intensity of the pain quickly escalated to unbearable levels. Seeing Mike's condition, his wife Linda became alarmed and rushed him to the nearest medical clinic, where I first met him. Mike's agony was clear, his face pale with discomfort, struggling even to sit still. After a thorough evaluation, including diagnostic imaging and blood tests, it was clear. Mike had kidney stones, specifically one large stone obstructing his ureter. Kidney stones are crystalline deposits formed from minerals and salts that build up in the kidneys. The size of Mike's stone made passing it naturally highly unlikely and potentially dangerous, requiring immediate medical intervention. I explained to Mike and Linda the reality of kidney stones with compassion and clarity. According to medical research, about 10% of adults develop kidney stones, and once you've had a stone, your chance of recurrence significantly increases. This information surprised Mike. He, like many others, was unaware of how common this painful condition truly is. But understanding the issue was just the first step. We needed to discuss treatment options carefully to resolve Mike's situation effectively. There are several ways to treat kidney stones, depending on their size, location, composition, and the patient's overall health. For smaller, less complex stones, we often recommend non-invasive treatments like extracorporeal shockwave lithotripsy, ESWL. This procedure uses external shock waves to break down stones into tiny fragments that can pass naturally through the urinary tract. Although it's as appealing because it requires no incision, ESWL doesn't always completely eliminate stones, potentially requiring additional procedures. For Mike's particular situation, ESWL wasn't an ideal solution. His stone was larger and firmly lodged in a difficult location, presenting significant risks if left untreated, such as infection or kidney damage. Another minimally invasive alternative was flexible ureteroscopy, where a tiny telescope is inserted through the urinary system to directly locate, break down, and remove the stones. While this option was appealing due to the absence of external incisions, the size and placement of Mike's stone made it less viable. Ultimately, I recommended the Percutaneous Nephrolithotomy, which PCNL procedure, highly effective for large or complex stones like Mike's. Understandably, Mike and Linda felt anxious upon hearing the need for surgery. Recognizing their concerns, I carefully guided them through every step involved in the PCNL procedure. I reassured Mike that despite the small incision required, PCNL was a minimally invasive, highly controlled procedure with an excellent success rate. On the day of surgery, Mike arrived at the hospital accompanied by Linda, his partner throughout this challenging time. After receiving general anesthesia, Mike underwent the procedure through a small, keyhole-sized incision on his back. Using precision instruments, I navigated into his kidney and successfully fragmented and removed the entire stone. Each fragment was meticulously accounted for and removed, preventing future stone recurrence. We also placed temporary drainage tubes to facilitate proper healing and minimize complications. Mike's recovery was remarkably smooth. Within a day, imaging scans confirmed the complete removal of the stone fragments, and Mike was relieved to hear the good news. Over the next week, he experienced mild soreness, but rapidly improved, quickly returning to his normal activities. To prevent future occurrences, I advise Mike about essential lifestyle modifications backed by scientific research. Adequate hydration, maintaining a balanced diet low in sodium and animal protein, and reducing oxalate-rich foods were critical recommendations. Mike committed wholeheartedly, determined to avoid experiencing such pain again. Today, Mike is back to his active lifestyle, enjoying family hikes and soccer games without fear. His experience highlighted not only the importance of prompt and effective medical intervention, but also the significance of preventive measures in managing kidney health. By sharing Mike's journey, my goal is to inspire and inform you, offering clear strategies you can use immediately to safeguard your own kidney health or support those you care about. Mike's journey illustrates how crucial understanding kidney stones is, not just in recognizing symptoms, but in taking informed action for effective treatment and prevention. Kidney stones, though common, can cause severe complications if left unmanaged. The good news is they're manageable and often preventable with the right knowledge and lifestyle adjustments. Now, it's your turn. Take Mike's story to heart and start incorporating these practical measures into your own life. Stay hydrated, pay attention to your diet, and never hesitate to seek medical guidance when symptoms arise. Mike's transformation from unexpected crisis to empowered health advocate can also be your story. Remember, change happens step by step, and I'm here cheering you on every step of the way. Thank you for spending your valuable time with us today. If Mike's journey inspired you, consider sharing this video with friends or family. It might help someone avoid unnecessary pain. Don't forget to like, subscribe, and leave a comment below sharing your thoughts or experiences. Together, let's build a healthier community, one step at a time.